Our prior authorization nurse, her main focus is on the ambulatory care guidelines. And just like you said, we use it for DME, we use it for procedures, we use it for medications, prosthetics, orthotics. And we use the MCG the same way we would use it for the inpatient care. So when you're using the product, it will ask you specifically about a procedure. And with that, we use the CPT code, or we use a HCPCS code, which is normally what you'll see with a DME. But when we use that and you plug it in, it gives you that same, guideline that you would have to meet those requirements. They would have to meet that criteria. So when we're using that for a procedure, which is very easy to use, the procedure may be for a hip replacement. You apply that according to what the member is going to need. You see if they meet that, whether it's physical therapy that had to be involved for a certain amount of time. Have they applied any other modalities before it reaches that decision? Well, do they qualify or not? With the DME, it's the same thing. Something as simple as a CPAP, you still would have to qualify that. Are they unable to sleep throughout the night? Are they really sleepy in the morning? Have they had apneic episodes? So you're applying it the same way you would apply it in the inpatient arena, where they have to meet those same benchmarks. It would be basically the same thing with ambulatory care, with orthotics. Do they meet those guidelines? And of course, if they don't, you have that ability to research as to why did MCG make that decision, which is another wonderful thing that we have, because everything is right there on that page. You can go all the way down to the bottom, and you can look at footnotes, and you can look at, you have all the documentation that you need for it to make sense to you. So we use that equally as often as we use it for inpatient and surgical care.